Hey everyone, it is Technique Tuesday again, and I'm going to keep this one short. As promised in my last video, I am going to go over some self-care techniques that I personally use for my own wrists and forearms. So if you do a lot of computer work, you're a fellow massage therapist, construction workers often have utilize their forearms and wrists a lot, can get some bakers with squeezing, so anything like that, these are some tips and techniques that I use myself. So first, if you kind of have your arm out in front and you place your 4 fingers beneath the wrist, just crossing that joint where it bends. And then you kind of bring the thumb on top, and I just kind of depress that joint. Kind of press in with my thumb so you can feel it kind of depress and move. So that kind of just opens the joint up. Carpal tunnel syndrome, or carpal tunnel, is depression of the median nerve when it runs through the carpal tunnel, which is just this little space right here, and oftentimes they just do a little snip on the surrounding ligaments or tendons to kind of give that nerve more room in there. And so this is essentially what you're doing by depressing and stretching that wrist joint there. So I can actually feel it depress, and then I just kind of move towards the fingers with my hand, the motion. You can do that more on the medial side and the lateral side of the wrist a few times. And then another thing I like to do is lock the elbow, bring my arm straight, stretch it back. And I can really feel that go up my forearm. I like to keep it straight ahead of my body, not really turning. That's just for camera sakes. And can do the other way as well. This arm. Oh yeah, so good. I really like to warm that joint up though with the compression first, and then do the stretching. And that I feel even more like right in here. So. And that's really what I do for my forearms. Again, if you want to get into some of your upper arms, I like to, stretch. And then I actually do a side bend when I do my triceps as well. And you can do this all sitting at your desk. Just gives you a little more stretch if you add a little side bend in there. Shoulder rolls are always good. Sometimes that wrist pain or arm pain is actually coming from up in the neck and stuff. So it's good to keep those shoulders stretched. Stretch the pecs. And that's really it for the arms. Yeah. There's some more targeted techniques. You can kind of feel this wad of muscles right here that travels right across here. You can kind of grab there. Sometimes that's real tender in there. If you feel a trigger point, like right here is kind of tender. So it's like a wad of 3 muscles. You can just grab and lift a little. You can actually cross the joint up to about where your deltoids attach, kind of up to there. You can do that. You can do some cross fibro grab and right around that joint. And I like to bend the fingers. Just keep them loosened. So, short and sweet today. I hope you all have an amazing Thanksgiving. Thank you for staying tuned, and I look forward to seeing you all soon. Take care.